chiropractor, we try and get to the root cause of the pain, which is usually a bone that has some form of dysfunction. In other words, it's not working correctly. With a chiropractic adjustment, we will locate areas of the spine that are very stiff, that aren't moving correctly, or maybe jammed out of position. And the job is to get them functioning again so that they can flex, so they can move. Physical therapy doesn't do that. So chiropractic is a great choice. After we do restore the joint dysfunction, physical therapy can be a great option because they're going to do some strengthening exercises. You'll learn. That's really what they're really trained for, is the strengthening and rehabilitation of stuff. But you can't do that over top of joint dysfunction, and so that's where chiropractic comes in. I think one of the things that we can do with your shoulders, especially for someone who has chronic shoulder problems, issues where uncomfortable cracking and popping occurs. One of the procedures we do in this clinic is a procedure called kinesiotaping. Skin up allows fluid to flow through the subcutaneous space, allowing the joints to heal. It also brings up nervous system awareness of these joints, so the joints move freer and smoother. Every time the patient moves the joint, it's actually causing a healing action. We taped her scapular muscles here, where a lot of people have pain in between the shoulder blades. This can help support that. We did the trap muscle. Those upper traps can get really tight and are involved in the whole shoulder girdle scapular complex. And then we did a basic deltoid taping, where we take the outer edges of the deltoid here and then support strip up the middle. Pretty thorough shoulder taping job. I just wanted to show you it is within the scope of some of the things that we do. So, whether it's a simple problem or whether it's a really complex problem, we can help you. Regular chiropractic adjustments always play into the mix, because the bones of the back can get jammed, and chiropractic is the only thing that can unjam those. The second thing you have to do to maintain back pain is do some regular form of exercise, both resistance training and aerobic type exercise. Aerobics about 30 minutes a week, 30 minutes a day, 3 times a week, and weightlifting 20 to 30 minutes a day, 3 times a week would probably do it. Followed by some sensible stretching, and you can stay in good shape. My kids, if they've had a rough week, with sports, with I've noticed some tripping and falling around a lot. I'll make sure I adjust them at the end of the week. If they have a rough week, get them in at the end of the week. We can clean up all of the problems and potential problems that could be developing from all those falls. Or, as in the case of this little Japanese boy that came in at the age of 2.5, he was tripping and falling all the time, which told me that there was a nervous problem with his legs. So if your child is falling and tripping just for no reason, that means it's a problem with the muscle control and the nervous connection between especially low back and the legs and the muscles in coordination, and you need to get that checked immediately to get those coordinative aspects back online.
Okay.
The pain medication that you take over the counter is what's called a non-steroidal anti-inflammatory drug. Those are safe if you use them very short periods of time, if the pain is very severe. I always say stay away from them if you can, because these inhibit inflammation. Inflammation is the first step of the healing cascade. So in other words, that starts the healing process. You don't want to stop that right at the beginning. You want your body to heal itself. That's what it's designed to do. Second thing pain medication can do is give you a false sense of security. In other words, you feel like you're doing better and you go out and re-injure yourself that much easier. So I recommend against pain medication in a lot of cases for the very reason that of those things. Now, as a chiropractor, I can't recommend a patient take drugs or not take drugs. It's not in the scope of my practice. For further consultation, of course, see your medical doctor.
Dr. Owens, I was wondering, what is sciatica?
Sciatica is back pain, lower back pain, irritation to the nerves that extends down and shoots down into the legs, one or both sides. As you may or may not know, the ribs extend from the back part, for they attach to the spine in the back, they form a cage and they go around to the front. And when we breathe, the ribs expand and contract in kind of a bucket handle motion. If a rib is twisted or torqued, it will put pressure on the nerve that runs directly underneath it, causing an extremely sharp pain, and that can be corrected with chiropractic adjustment. I wanted to go over one of the ways that we can work on someone with low back pain. If we look at the spine here, this would be looking at somebody from behind. I'm going to set the spine down here on the table. Sometimes folks have pain in the side of the lower back, not dead in the middle, but off to the side, and that is pain generated from the SI joint or sacroiliac joint. And so how we work on that, we have to restore the motion of that joint. And a great tool to use is the arthrostim. And what we do is we just palpate or feel to see which is moving and which is not, and we find the areas that are stuck, and we just want to restore that motion. As we restore the motion, the body then restores that nervous input from the joint up to the brain so that it moves normally and feels a lot better. So that's one of the ways we can work on SI joint pain or low back pain that's off on the side. Have a great day. It can be serious conditions that cause back pain. If it's something like cancer or a ruptured disc that's beyond help, with cancer you'll tend to get a very hard boring pain, and it doesn't go away no matter what you try. With something like a ruptured disc, it's an extreme pain. The pain will probably be at about a 10 out of a 10 on a pain scale.
Wow.
It will be intense, so intense, in fact, that you're thinking that you need to be at a hospital for morphine right now. There can be degrees of these conditions, and that's why it's never bad to go get opinions from medical doctors or have imaging done, like MRIs or X-rays. I work with patients, especially if they're not responding. We want to make sure and rule that kind of stuff out before we continue on with chiropractic care. But 90 to 95% of all pain conditions in the spine are something that we can handle and take care of just nicely. So,
great.
A great little technique I learned and that I used myself to keep the shoulders pain-free, keep them mobile, and help you before your workouts, after the workouts. And all you need is a little stretchy band. And you can use any kind of stretchy band that you like. The exercise is called stretchy band dislocates. And what we're doing is we are going to work the shoulder through a range of motion where it's tight. Because we seldom move the shoulder back. We're always forward, doing computer work or working on stuff. To keep the shoulders healthy, we have to stretch them backwards, which stretches the pecs, but also work the joint capsule in the posterior or back aspect of the shoulder capsule. So that's what we're doing here. We're just mobilizing it. I suggest 10 to 15 times, and as you work that, you can feel it, and you'll start to get a little lactic acid burn. That's good. It's doing what it should do. Don't get too crazy with it. When you start out, what's nice about the stretchy band is that it'll accommodate with you a little bit. So you can start out, if you can only go to here, keep your arms locked. If you can only go to here, great. Work that motion. As you become more flexible, you can choke in on the band a little bit more, get a little better stretch as it goes over that.
Dr. Owens, what are the dangers of auto accidents?
Auto accidents, provided you didn't get hospitalized or nothing broken or fractures and death can result from auto accidents, but provided none of that happened, the biggest dangers of an auto accident comes about from the mechanics of the injury itself creating a situation where there's chronic pain, specifically in the neck. If we look at the mechanics where the head you're in your car seat, hopefully your car seat's all the way up, but typically the head will translate backwards when another car hits you, and when it goes backwards, all the structures in the front of your neck will tear. You can get some tearing in the front muscles, like the sternocleidomastoid muscle. You can get some tearing in the little ligament that runs down the front of the spine, creating some weakness. Then the head then goes back forward with the potential of tearing muscles and ligaments in the back. Now, when these structures tear, specifically in the back, is what gives us the chronic pain over time. Research tells us there's little receptors in here called proprioceptors, and they're parts of nerves that get injured. When these get injured, the head doesn't know where it's at in space, and you get the potential for re-injury and chronic pain. So that's one of the biggest things to fix. As we work with you with chiropractic care, getting the bones back in the corrected positions, working with the scar tissue of the muscles and ligaments, we restore it as much as we can to its prior state, and help prevent that chronic pain from happening for the rest of your life.